match?
So I matched in neurology at Cooper University Hospital, New Jersey.
Can you talk a little bit about your medical journey? How did you get to where you are now?
So I did my med school from Common Medical College, Amritsar. So I am a 2019 graduate. So 2018 graduate. So I know because year of graduation is a big deal. So that's why I'm just letting out this for everyone to see, to get an estimate of my profile. So I then decided to do the USMLE after I graduated. So that is something that I would say to all those who are planning to go for USMLE to begin planning during your internship and not after you graduate, because that brings along with it its own set of problems. And then I wanted to go for neurology. So at that time, because the rotations were not open, I heard of Dr. Bernad, his tele-rotation, because of COVID, I was not able to get an in-person rotation. And so that's how it all came to be. Uh, that's how I reached AMIQT, because it's one of the very few rotations, one of the very few people who are willing to help out in terms of gaining the US clinical experience.
Which rotation did you do with AMIQT? And was that
I did,
impactful for
yeah.
the residency process?
So I did neurology rotation with Dr. Bernad, and it was immensely helpful for me because, as I said, the there were not many opportunities available because of COVID to get the hands-on, or even just the clinical experience, not just the hands-on, but even the clinical experience. So I had only 2 months of clinical experience on my application while I applied for neurology. So I was a bit worried that how will it pan out. But luckily, Dr. Bernard's letter of recommendation was very helpful. It was brought up by interviewers a lot of the times. They were quite impressed by what he had written for me, and also they were very because this is the first time that this tele-rotation concept has started. This was the first match cycle when this all happened, so they were all very intrigued to know that how it all happened, how the patient interactions went on, and how did we learn about the subject in the first place. So that's why it was a very unique experience, and something that almost everyone was quite impressed with, that how I was able to do this at distance, safely, and in a telehealth model.
So how would you say the rotation was helpful?
So, firstly, I would just say, by a clinician's point of view, that it was helpful to me because I got to see a lot of cases with Dr. Bernard. One thing that I feel that I learned a lot was how important it is to have empathy with the patients. Extremely good clinical, the communication skills that Dr. Bernard has, the reputation, the repo he has with his patients is just so impeccable, that how his all of his patients just love him and adore him. And to be able to witness that and also to learn from him the passion for neurology, I feel that it was immensely helpful. I got to learn a lot. And he and Dr. Stein, they used to regularly teach the EEG lessons while we were on class. So whenever there was break, every time he would play on a recorded lesson for EEG, so that even when there's a break, we can, there's something that we are learning continuously, right? So that's why it was not just the patient interactions which were good. So firstly, we got to see every patient in Dr. Bernard, whatever patients he had in a day, we could see simultaneously all of us in a group. That was the one of the best points of a tele rotation. Number one. Number two, the didactic sessions, the learning sessions which we had, especially of the EEG. I would say I got to learn a big deal, which would otherwise not have been possible. And certainly we all got a chance to do the case presentations. Again, something we all need to learn as future residents, because we will have to do the grand rounds, prepare our presentations. So again, that was helpful. And most importantly, I would say, would be LOR, the letter of recommendation, because Dr. Bernard is highly reputed in his field and also quite well known. And he wrote a very good LOR for me, is what I know from the interviews, because they were the ones telling me that he has written an excellent LOR for me. So that's why I'm extremely grateful for this whole experience, and very thankful that I could do this with him. And Yeah, so these are the ways it's helpful. I'm sure that I'm missing out on some other points, but this was truly one of the best experiences.
Last question. Do you have any advice for people applying to US residency?
So, advice, I think the first advice would be start early so that you, because the challenges that may come later in the path, that is the year of graduation or just everything. I think starting early helps in the process of your assembly. That's the number one. Number two, definitely focus on doing well on your exams. And even if you don't, because sometimes the scores and those are the things which are not very well in our control, right? Sometimes things don't go as per how we plan out uh, for ourselves. So then comes the most important part, that's the US clinical experience. I think that I've been very fortunate to have done to have gained the US clinical experience with the masters in their field, like Dr. Bernard, I would say, in neurology. So choose wisely, I would say. I would say go with the mentors, go with the people who are very willing to teach and who are willing to recommend you to the residency programs with all their heart, and also be very sincere in whatever you do, because you just can't expect to be there and not participate and then expect the LOR at the end. You have to be very willing to learn and contribute as well. So that's where I would say that Dr. Bernard's rotation was a huge learning point for me in this whole process. So definitely plan out your US clinical experience well, even if it's the tele-rotation, which we all know is going to be the future of medicine from here on. So that's why doesn't matter. I would say definitely go for this. It's one of the most I would say it's one of the best decisions you would make for yourself, especially when applying into neurology, I would say. And apart from that, work well on your CV, your personal statement. Again, something that AMIQT helps with, and they did help me with that as well. Whether it was Dr. Naka helped me immensely whenever it came to filling out my CV and personal statement. So I would say that these are the things that we all need help with and we all need mentorship with. So go to someone who you know would do their best to help you out. So for me, it was definitely AMIQT, and I have a lot to thank you all for.